Hi there, it's Justin Lubino with Senior Advisors, and it's getting to that time of year where we have to review the Part D plans for 2019, and we're just preparing our materials and wanted to give some updates of some of the changes coming in 2019 with regards to the Part D plans. This video will give a brief overview of how Medicare Part D works and specifically what some of the changes are with Medicare Part D for 2019. This does not get into specific changes for each Part D plan because those changes don't come out until October, but the rules that affect all Part D plans will be reviewed in this video, as well as an example of someone reaching the dreaded donut hole to try and walk through how that impacts the individual. So the first slide here just discusses the different tiers or steps within Part D of Medicare. And the first step you see here is the annual deductible. And in 2018, the highest deductible that a Part D plan could have is $405. In 2019, that's increasing to $415. Okay, there's still some plans that have zero deductible. So at least in 2018. We don't know 2019 yet, but the assumption is there will still be plans out there that will have a zero deductible in 2019 as well. Even if a plan does have a deductible for Part D, the deductible normally only applies to the higher tiered kind of brand name drugs or higher tiered generics. But if you're in a low cost, low tier generic, the deductible normally does not apply. So you just pay the that low copay for that particular medication unless it's a brand name drug. So if it is a brand name drug, you're going to pay the full cost up to the $415 if you have a $415 deductible. All right, step 2 is the initial coverage level. All right, in 2018 it was $3,750. In 2019 this is increasing to $3,820. So a small increase here. Now this is based on the retail costs of the medications you're taking. As long as your retail cost of your drugs is less than $3,820, then you're just going to pay a copay or coinsurance for your medication for the entire year, as long as you don't exceed that $3,820 retail cost. Okay, this is not copay or coinsurance cost. This is what the full cost of those drugs are. As long as it's below the $3,820, you're just paying a copay or coinsurance. In the example I'll show on the next slide, it will explain this a little bit clearer with what does retail cost mean versus copay. But if you exceed the $3,820 retail cost, then you fall into what's called the coverage gap. It's also called the donut hole. There was some legislation passed in February of this year, which actually significantly improves this step 3 for those individuals that are going to hit the donut hole or the coverage gap. It still is going to exist, but it's going to be much less of an impact based upon the changes that were made in the February Bipartisan Budget Act of 2018. So this will definitely help with the drug costs for 2019 for those that are reaching the donut hole. So let me explain. So if you exceed that $3,820 retail cost, you fall into this donut hole where you're paying 25% for brand name drugs or 37% for generic drugs in 2019. So these numbers went down. So in 2018, it was 35% for brand name, or is 35%, and 44% for generics. In 2019, you're going to pay a smaller percentage of the drug cost while you're in the coverage gap of 25% for brand name and 37% for generic drugs. So that's a positive right there. You're going to pay a smaller percentage. The other big change is the reason you're paying a smaller percentage is because of a greater discount coming from the pharmaceutical company. So in 2018, it was 50% that was being discounted by the pharmaceutical company while you're in the donut hole. But this bill, Bipartisan Budget Act of 2018, increased the discount from 50% to 70%. So you're getting a 70% discount for brand name drugs from the pharmaceutical company. And the reason that's important is the amount of time you're in the donut hole is based upon something called true out-of-pocket cost. And again, this will come clear on the next slide when I show the example. But you're going to be in the donut hole until you exceed $5,100 true out-of-pocket cost. Now, the way the true out-of-pocket cost is calculated, I don't agree with this name, but that's the name of this term is true out-of-pocket cost, is the total cost you've paid for your medication. So any co-pays or co-insurance you've paid up to this point throughout the year, including the amount you're paying while you're in the coverage gap. But it also includes the pharmaceutical discount for brand name drugs while you're in the donut hole. So what that means is this increase from 50% to 70% means that you're going to reach this 5,100 number more quickly than you would in 2018, because if they're only giving you 50% credit towards this 5,100, obviously it's going to take you longer than if they're giving you the 70% credit towards your 5,100 true out-of-pocket cost. So you should technically get out of the donut hole more quickly in 2019 because of this increase from 50% to 70% discount from the pharmaceutical company. And then you reach catastrophic coverage where you pay only the greater of 5% the cost of the drug, or $8.50 for brand name, or $3.40 for generic drugs. So if you can get to this, if you're on expensive medications, the quicker you get to catastrophic coverage, the better you are, because you're only paying 5% rather than 25% for those expensive brand name drugs that you're paying in that donut hole. So that's just kind of a quick 5-minute overview of how Part D of Medicare works with each one of those steps and how that donut hole works. I think an example helps to illustrate this even further. So I created just a quick example, which may be a little tough to read here. So I'm gonna just explain what's in this chart. Let me see if I can zoom in without losing the video here. So this example is if you're on one medication, one brand name medication with a retail cost of, let's say, $955. Okay, so if you're on one medication and it has a retail cost of $955, let's just say your copay for this medication is $40. So you have a decent Part D plan, and even though the retail cost is $955, your copay is only $40 for this medication, and your Part D plan has a zero deductible. Okay, so this is just an illustrative example to try and illustrate how that Part D donut hole will work. Let me try and make this a little bigger. And again, the same values we had on the prior slide are brought over here. So the initial coverage level in 2019 is going to be $3,820 based on the retail cost. The pharmaceutical discount in the donut hole is 70%, and the member pays 25% while you're in the donut hole. The catastrophic true out-of-pocket limit is $5,100, so that's the other side of the donut hole. To get you into catastrophic, you have to have $5,100 true out-of-pocket cost. So this table at the bottom shows if you have that one medication that meets all this criteria we just went through in the example, then your total cost for the year for that drug are going to be about $1,570. $1,574 is what this model illustrates, with the $40 copay, with the donut hole, and with the catastrophic coverage in the last couple of months. Your total cost for the year for that $1,000 a month drug is about $1,500. So, not saying it's inexpensive, but for almost $1,000 a month retail drug, you are getting pretty good coverage when you think about it from Part D of Medicare. Rather than paying $12,000 for the retail cost for the year, it's costing you about $1,500. Now, the way this breaks down, the first 4 months, you're paying that copay, the initial coverage level. So as long as you're below that $3,800 retail cost, $3,820 retail cost, you're just paying the $40 per month copay for that medication. Again, this is just an example. It could be higher than that. It could be lower, but we're just assuming that it's $40 copay for this example. Now, underneath of this, we have the running retail cost. So you can see the first month it's $955. The second month you double it, $1910. You continue adding the $955. Now that fourth month in April, you've exceeded the $3,820. You've actually just hit the $3,820 after 4 months of paying $955 a month retail cost. you're not paying that. You're paying the copay. But after reaching the $38.20 retail cost, you've now hit the donut hole. So now you can see, instead of paying $40 for that drug, now you're paying 25% of the $955, which is $238 a month. So now you can see the impact of that, reaching that donut hole. It gets very expensive once you hit that donut hole. You're paying that $238 a month until you hit September. And now you've exceeded the $5,100 true out-of-pocket cost, which I'll explain in a minute, and you've fallen into catastrophic. Really in October is when you hit it because it's a partial month. And then the last couple of months you're paying 5% for your drug, $47, which is 5% of the $955. So that's how those different steps work with an example. To explain this part a little bit better about how you get to the other side of the donut hole, these rows down here explain that true out-of-pocket calculation. So the true out-of-pocket, if you remember from the prior slide, it includes the amount of money you've paid for your medications plus the pharmaceutical discount for brand name medications while you're in the donut hole. Okay, so those first couple of months, there's no pharmaceutical discount for the brand name drugs in the donut hole because you're not in the donut hole. So your only true out-of-pocket cost is that $40 a month. You're paying copays for your medication. And this is the running total of the true out-of-pocket cost down here. So you're up to about 160 true out-of-pocket cost after April because you just paid $40 in copays. Now you hit the donut hole in May, and you're getting credit for 70% discount, the $668.50 from the pharma company, plus the 25% that you're paying while you're in the donut hole. So your total true out-of-pocket for May is $907, which gets added into the 160. So now you're up over 1,000 true out-of-pocket cost. In June, another 907 true out-of-pocket. It just keeps getting added on. July, August, September. And by October, now you've halfway through the month, essentially, or half of the cost of the drug, I should say, you've now exceeded the $5,100 true out-of-pocket costs. And now you're at the other side of the donut hole, which is catastrophic, where your costs start to drop again down to the 5% that you'll be paying for your medications. Okay, so that is just an example of how the donut hole works and how catastrophic coverage works. Again, this is just a one drug example, but if you have two drugs that equal $955 a month retail, it's the same logic applies, or three drugs or whatever. I just try to simplify it with one medication to show you how the donut hole works and how catastrophic works to help illustrate for you. So just a quick note here on why you should be working with senior advisors. If you work with senior advisors for your Medicare planning, you'll probably have a big smile on your face. And if you don't work with us for your Medicare planning, you might not be too happy. You might make a mistake. It could cost you thousands of dollars, specifically around the Part D plan if you pick the wrong Part D coverage. So we'd love to be able to help you out with your Medicare planning. Here's some other resources we have available. If you follow us on Facebook, we do a live Q&A session every Monday. We're trialing this every Monday at 10:30 a.m. And it's about a 15 to 30-minute session. It just depends on how many people are joining and what types of questions we get. But this is every Monday at 10:30. This is Eastern Time. We also have a YouTube channel out there. We've got about 15, or actually closer to 20 videos right now, where you can subscribe to our YouTube channel for senior advisors, and you'll get access to all of our videos that we publish on YouTube. And then our website is another great resource. We've got a full 90-minute Medicare workshop video. We have a form where we can do a free Part D analysis for you. So if you're looking for a review during annual enrollment, or if it's your first time enrolling in Medicare and you want a review to make sure you have the right Part D coverage, we have a form on our website where you can fill that information out, and we'll do the Part D analysis for you. There's no charge for that. We do blog articles weekly or monthly, sometimes more frequently though. Weekly we sometimes do them. And then we have a quote tool as well. You can fill out your information if you want a quote for a Medicare supplement. We can certainly help you in that regards. We work with all the top A-rated companies out there, and we'd love to be able to help you. Again, my name's Justin Lubino with Senior Advisors, and hope you have a great week.